Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. Hello, I'm Dr. Susan Little.
And this is Dr. Jolle Kirpensteijn. This is the Purr Podcast. That was really good, Dr. Susan.
No.
I know, because I put you on the spot.
Yeah. So this is our sixth podcast guest in a row, right? And I think I've flubbed 4 of them. The intros.
Yeah, so she's really strong
I'm bad on intros.
Intros when I count down, which is relatively normal.
Yes.
And then I get this there and there.
Yeah.
Look at me.
Yeah.
I'm not supposed to do anything.
Is it my turn?
Right.
Yeah.
Now?
Right.
What
That's
he hasn't told you is that he'll wait until I'm like, drinking coffee.
Yeah.
Anyway, so our poor podcast guest is sitting here going, I'm between two crazy people.
Yeah, what am I doing?
I am like the rose between two thorns right now. That's who I feel like. I feel like that's who I am.
Someone compared us to the 2 little old guys of the Muppets.
Oh, no.
Yeah. Looking down, focusing on everybody.
Okay.
I take offense to that
Yeah.
because I'm not that old. And I don't think I'm that cranky, although Yola's like, oh.
And you look like a Muppet.
Good point.
Yola.
Good point.
Oh, my God.
Maybe a little.
Oh, my God.
You got a little Muppetish in you. You can do it. You can do it. She's a Muppet.
100% Muppet. But that's okay. So we are here with our wonderful guest that we have not introduced yet. So would you like to introduce yourself?
I would like to introduce myself. I'm Dr. Pamela Jones, and I'm a medical radiation oncologist, and I also wakeboard, and I play pickleball, and I do a lot of other fun things. So,
there's a lot of things
I
to talk about.
only learned what pickleball is because you explained it to me when we were somewhere. I'd never heard of it.
How'd you explain it?
It has a little ball with holes, and you have to hit it over the net.
Okay, there's a lot of games that are very similar.
Yeah.
People ask me, I say it's a smaller court with a paddle instead of a racket, and it's for people that don't want to run around and play singles tennis.
Right. Which I do, and I love that. So,
Why is it called pickleball? Where's the pickle?
I don't remember the history behind
There must
it,
be something.
but there is a history, and it was years, and it wasn't just like everybody thinks it just came up in the last 10 years, but this is actually a sport that's been around like 50, 60 years.
And by the way, this is a podcast about cats, so
I
it's nothing
understand.
to do with pickleball, but it is very interesting.
We started yesterday with a podcast on geography before we realized we're supposed to be.
I was going to say this is about cats.
Okay, but I have one last question. What is wakeboarding?
Wakeboarding, well, I love boating, and I used to love water skiing, and wakeboarding is just water skiing, but you have a single board instead of a single ski.
Yeah.
Just different.
Gotcha.
It's one of those sports you drag someone. It's a wider one. And you drag somebody behind a boat. You stand up on the water.
Fast, doesn't it?
It goes fast. It's
And it
fun.
hurts when you fall.
We try not to fall. And you let go of the rope.
No, but
If you
people
fall.
tend to. I've seen people do wakeboarding, and I've seen people fall pretty hard. Is it painful when you fall hard?
If you smack your face, it can hurt.
Right.
Yeah, it can hurt if you do one of those little face plants. But,
Right, I can imagine that. Because the boat goes how fast?
Well, for water skiing, it's about 30 to 35 miles an hour, just depending on how good of a skier you are, that kind of thing. I mean, I tend to ski around 27. Wakeboarding is slower. It's like 15 to 20.
So you have to imagine that you hit hard water at 20 miles
an hour. That's a lot. It's a lot different than just getting a glass of water thrown in your face.
Right.
It's really has an impact.
Right. And wakeboarding is the official term for that.
Wakeboarding. Yes.
But it sounds like fun, though.
Oh, it is.
It's action-packed. So
it's a great sport.
Right.
Great sport.
And are you just jumping over things too, or is it just flat?
So I'm not like the professionals. I don't do flips in the air and all that kind of stuff. I tend to just jump over the wake. You know, if I get like 3 inches of air, I've made it.
And that's why they call it wakeboarding.
Wakeboarding, because you go over the wake. Yes.
Right. So does the boat do? The listeners don't hear this, but I'm just moving
going
my
back
hand
and
up and down. So to make wakes that you go, or are you just doing yourself this?
Yes, but there's also boats made for it that wake down the boat in the water so that you get a bigger wake.
Cool.
For those of you who are confused and thought you stumbled into an ESPN podcast instead of
Do cats wakeboard?
I will tell you honestly, I would not want a cat to wakeboard. And actually, I think they're just smarter than that.
Yeah.
Right.
Like they literally go, no.
I like that answer.
No.
You won't get me on that.
When Jolle and I lecture about GI foreign bodies, I always point out they're far less frequent in cats because dogs are stupid.
Dogs are stupid. They eat anything, and a cat looks and goes, why?
I'm not doing
Okay,
it.
not eating that.
You were twice.
I did?
Yeah.
You said it today too, though. So.
Yeah.
Just saying.
We're not allowed to say
no
the
D
word
words.
on this
No D
podcast
words.
now.
Okay, from here on.
Because, as a matter of fact, we started this podcast because we feel that there is too much D and not enough cats.
There's absolutely too much D and not enough cats.
So.
One of our other guests that we recorded today pointed out that so we're at the American College of Veterinary Internal Medicine meeting in Minneapolis, pointed out that if you look at the presentations, it's still a minority of cats. Like it's not as much as it should be.
Oh, and I've been attending oncology for the last 2 days, and I will tell you I've not seen, well, I take that back. Tracy Geiger, who, if anybody knows her, she's board in internal medicine, medical oncology, and radiation oncology. She's one of those brilliant people. She's fun, and she is hilarious, and she actually lectured on nasal tumors, and she makes it very clear she loves cats. Like she has cat poodle type skirts, and she loves cats, a cat purse.
You said cat poop on her.
Yeah, no, not poop on her, no.
But it could be true.
But she lectured on feline nasal tumors was part of her talk. And it was great because I was like, I haven't heard the C word anytime until her lecture.
Yeah, it's true.
And with the C word, you mean cat.
Cats.
Yeah.
I mean cats. I mean the 3 letter C word.
Yeah. It's kind of frustrating, right, at this.
It is. And I think, and she actually, I sat by her after her talk and I said, well, what percentage of your caseload is cats?
Right.
And she said, honestly, I wish it were 80%, but it's 20%.
Yeah.
And it really, and yet, again, like you said, if you're coming here and you're trying to learn as a feline practitioner, there's just a paucity of information, new information coming out.
I have to say, in my practice, when I was still at university, which is probably tertiary, and because I was known because of that, I got quite a lot of cats. And that's because of, at that time, the fibrosarcoma, injection site sarcomas, and the squamous cell carcinomas in the mouth, because nobody wanted to deal with it, so they sent it. And then we had a lot of endocrine cases that were also feline. So I at least saw 50% cats.
But in Canada and the U.S., it's not often been like that, not in tertiary care. And, even in many of the vet schools in Canada and the U.S., if you go to their community-facing practice, their first opinion practice, they still often don't get enough cats.
Wow.
And that worries me because they're training vet students, right, in community practice.
So we normally start this podcast not 10 minutes in, but we normally start this podcast with a question. Can you tell a little bit how you got where you are right now?
Oh, wow. So I work in pharmaceutical development. And actually the way I got there, because I had a very lucrative private practice in medical oncology and radiation oncology. And I got there because I volunteered and got appointed for several scientific advisory boards. And I found an interest there. I found a niche of, wow, this is interesting and it's a challenge, and gradually migrated in that direction.
And before that, you started as a vet student.
Where'd I start? Oh, well, Colorado State.
Ooh.
So I came from Colorado State.
Yeah.
I was that 4-year-old that said, I want to be a vet. And that's what I did. And when I went to vet school, I wanted to be a food animal vet.
Really?
I can see that,
Yeah.
Did you have any farm in your background?
Well, I worked as a technician for 7 years at a general practice that was mixed.
Yeah.
And so we would palpate cows on the weekends and preg check, and then we would do, we'd go out at lunch for lameness calls on horses and colics, and we'd spay and neuter and do dentals on cats and dogs.
Isn't it? It's very active.
It's go, go, go.
Yeah, yeah.
And he ironically was the only vet in town that would do birds or reptiles, and husbandry was very young at that time, very young. And so he was fixing a lot of things that I think now we've fixed with nutrition and better husbandry and such. But so that I went to vet school. I worked at a private dairy farm for 4 years. Loved every minute of it. I would go back to milking cows tomorrow. That was fun.
Yeah, that's great.
Hard work. You have to do it 24/7. It's not, you don't take the spring off because everybody's calved.
Right.
So how did what flipped the switch?
The switch to oncology was
or even small animal though.
Small animal. That was literally, a lot of it just had to do with, I got more and more interested in what you could do in small animal versus husbandry.
It's very different.
Very different. It was managing herds versus managing individuals. And I like that. I like that one-to-one,
they're very different.
What can you do for this patient versus this herd of 1,000?
Yeah. Your brain either likes one sort of paradigm or the other, I think.
Yeah, it was a fun mix. It's interesting that I look back now and I think, wow, who would have thought?
Yeah.
But look at us now.
I started with a mixed seminary too, and that's when I went into vet school. I was very I didn't know what I wanted, so I wanted to do horse, and at a certain point I did this cow claw course, which is just and it was amazing. It was in the middle of nowhere, and I didn't have a lot of experience with cows, so it was not the best.
I was going to say claw. Cow claw.
I think he means
hoof trimming. Okay. No, I don't have claws. Cows?
Cows, no, they're usually called hooves.
Hooves, okay. Yeah. Hoof trimming course. And in the middle of nowhere, and it was amazing. I loved it. But then I thought, it's kind of dirty and...
It's dirty. But let me tell you a story about. So I was, we did artificial insemination then, right? Yeah. That was just what we did, and to not have to have a bull on the property, and I had the best insemination rate. I will say my conception rate was very high, but they would laugh at me, all the herdsmen, because I was so short. And we're working on Holsteins, and if anybody knows, I'm 5'2".
Right.
On a tall hair day, I'm 5'3",
Right.
And I literally would walk out there with my little bucket, put it down, and stand on it.
I was going to ask you that, because...
Let the cow stay forward, so you're okay.
I'm barely 5'3", and during vet school... It was, let's say, challenging for Susan to work with these animals.
And my classmates would be, have Pam do that one. And it'd be a big, tall Holstein or something. I'd be like, why? What are you guys saying?
You need a ladder.
It was great.
Well, so you switched to individual animals.
Yeah. Did you go into private practice right out of school? Or?
I did. Well, I went and did residencies, but I loved academia. I did, but I kept thinking politics. Yeah, and I just couldn't do it.
That's what kills people.
As I'm older, I realized that politics is everywhere. Yeah. But I went and thrived in private practice. Mm-hmm. I loved it. Mm-hmm. I loved private practice. It was just fun.
So did you buy yourself into a practice, or you just started one?
No, I actually bought into one. Well, my first practice was, for anybody out there, Mary Kay Klein. And she was the first practice I joined. And in fact, I just did a talk here at ACBIM, and I said, boy, most people regret their first job, and I regret that I left my first job because she's a fantastic human being.
Good thing to say. Good thing to say.
She's a fantastic human being. And so, that's where I started, and then eventually went on to another practice, which I bought into, and then eventually just said, no, I've sold that, and just worked for someone.
Mm-hmm. But at some point, you decided to what? Had you done your residencies by then, or okay?
Yeah. Okay. Yeah. Residency. So my second residency in Rad Onc was with Mary Kay, and then I stayed on with the other practice. But
I see.
But so it's interesting how those things evolve, because I also liked emergency medicine. There's a contrast.
Yeah.
Now the question is,
we have a job for you in Canada.
Do you know emergency medicine?
Okay. Yeah.
I got headhunted today for.
Did you?
Yeah.
Okay.
Yeah. For an emergency medicine job in my own city.
It would be awesome.
Wow.
And I own 2 clinics already.
Really? And they headhunted you. That's great. That's great.
There's sometimes a little disconnect.
Yeah, a little
between the
disconnect there.
headhunter and
I wouldn't put a lot of faith into that particular company. I think they're a scrape of the bottom.
because if you asked me to do emergency medicine now, I'd be like, what do I do first?
Yeah.
You know?
Yeah.
What do I do first?
But I think that's
Triage that patient. Yeah, there's the exit.
Yeah.
That's a certain personality type, right?
It is.
I think it is.
It's an immediate feedback.
It is.
Fix it, and that was where I had a problem. I wasn't getting the feedback of did I make a difference?
Yeah, because there's very little follow through, right?
Green told me one of the first days I was there, treat them or street them.
Treat them or
Treat them.
Yep. Okay.
My job is to treat them, put a Band-Aid on them, but not that. And what I was told when I was doing emergency was, but you don't need to diagnose them. And I was like, because the first time I turned in like a ACTH stem or something like that, as an ER vet, they're going, why'd you do that? I go, because he's going to have to do it tomorrow.
Yeah.
Right.
And they're like, no, you can't do that. I'm like,
I would have trouble with that too.
what am I supposed to do now?
Yeah.
Yep.
So why oncology?
Yeah.
Oh, that was a personal dog thing, you know.
Really?
So my first dog, and I owned dogs as a kid, but my first dog that was mine, only mine, Bear. You know, I'm really creative with naming at that time.
Right.
She
was a child?
She was a black lab golden retriever mix, and she was beautiful. And of course, I had been a tech for many years. She sneezed once, epistaxis, unilateral, and I had her into the teaching hospital, and we went down that path. And it was a nasal carcinoma. Now, I was like, okay, of course, I'm a poor vet student.
Yeah.
I knew MK Klein because I'd met her through my mentors. And she said to me, if your dog needs nasal radiation, just bring, and at the time, Colorado State had shut down their LINAC and were replacing it. So I couldn't even get it done there. Mm-hmm. And I said, okay, let me do all the staging and everything. And this dog in 6 weeks had metastasis everywhere.
Oh, shoot.
She had an iridial metastasis. And I still remember going into the ophthalmologist and he goes, oh, this is amazing. and he looks at me and was it Matt's? I can't remember the ophthalmologist's name. I think it was Matt's. And he looked at me and he goes, I apologize. And I go, no, I'm a vet student. I get it. It is really cool. Yeah. And I got really interested in it that way. And I just, cancer became friend or foe. Yeah. And that sounds odd. But if you think about what a cancer cell does and what we can learn from it, it can be an amazing friend. Mm. But it's also something that we fight all the time.
Yeah.
So,
And we had a lot of discussions today and yesterday about the immune system and how good it does, but how it also fails us often doing too much or not doing enough. Like
absolutely, yeah.
And so not just oncology, but radiation oncology.
Yeah, and that truly. So when I was applying for medical oncology residencies, MK Klein said, "Pam, I'd take you for a rad onc residency in a heartbeat," and I said,
right.
You know,
mistakes that we make.
I know. And first year into my med onc residency, I'm calling her on the phone. Can I do a rad onc after I'm done with this one? She said, absolutely. Call me when you're done. And so I went right into that one after my med onc. They worked hand in hand. It was like, you know, it was one of those. It's just I can't do one without the other. And
but you have to do two at the time. So.
Yeah.
Good for you.
There is that.
There is that. There is that
little thing.
That little quiz.
One of our other guests is on her second PhD, right? And I'm just
my God.
I know. Yeah. I don't know about Jolle, but I'm feeling like really kind of low class talking to all of these guests.
So you do okay.
You've done okay. Yeah, you've done all right for yourself.
We have a guest today who not only is a veterinarian and she has her law degree. She has a first PhD under her belt. She's on her second PhD.
Well, I
feel like a sloth.
Two things that are not on my bucket list. PhD is not on my bucket list, nor is a jurisprudence law degree. Neither one. Yeah. So I won't be doing those. That's brilliant.
So
although I really enjoyed my PhD.
Did you?
I thought it really, I mean, what you're doing right now in your job that you have right now, that's what you're doing in a PhD too.
Yeah.
So it's really the deep dive in to have a very small focus area where you deep dive into, you set up the ideas, you work out the ideas, you execute the ideas, and then you come to a conclusion, which very often is, you know.
So this is an old story, but I was a resident, and I remember Barb Kitchell looking at me saying, Danger, that was my nickname. Danger, you should stick around and do a PhD in immunology. I'm like, what?
Yeah.
5 years later, I'm like, I should have stuck around and done a PhD in immunology because that's what we do now.
Yeah.
You know, I mean, 20 years later, we're immunologists.
And I just want to say before we forget, for our listeners, the double PhD person I'm talking about is Petra Cherna.
I know the name.
Working with Mike Lappin at Colorado State.
I know the name.
So if you haven't listened to the 2 episodes we did with her, please have a listen. She's amazing.
And I can tell you that I almost became a radiation.
Really?
Yeah. So I was at the University of Georgia.
Okay.
And I did not get my surgery residency, so I was a little in a dip.
Yeah.
And then I got an offer to be an ophthalmology resident.
Oh, the other O.
The other O. And then Mary Mahaffey at that time from the radiology department said, we have a new idea. This is not really a radiology residency, but it's working with a very famous radiation oncologist that is doing mainly, radiation for research. But we want to do it in patients. And this is very, very new because nobody does it yet.
Yeah.
And we will offer you that position. And I'm like,
what?
I want to be a surgeon. Okay. I could have been a radiation oncologist, one of the first radiation oncologists. It could have been this ophthalmologist that is just, but anyway.
Yeah.
It turned out to be a
That's
surgeon.
where life takes
Surgery took you where it needed to take you.
Yeah. And then I came back to oncology and I was like, oh, yeah, radiation oncology is quite interesting.
It's quite interesting.
Right.
It's a thing.
Yeah.
It's a thing.
Yeah. It stuck around, that idea.
It did. And it really caught on.
Yeah. So are you you're working for a pharma company now?
Yes.
So when did you make that change?
When did I make
and
that
why?
jump?
Yeah.
So
I'm always curious why people do that.
Yeah. So there was a couple of things. One, I like scientific advisory boards made me realize I liked the whole pharmaceutical development side. Yeah. And
my brother works in pharma development. So.
Yeah, I probably should have done a PhD. And so I just got interested, and I had the opportunity. Well, part of it was 20 years of medical oncology, radiation oncology practice. I was at that point where, look, it's really hard to see 30 patients a day still and still just keep going and going. And I realized that I was not as, and I'll just say not as fulfilled. I wasn't as fulfilled. I loved being a medical oncologist. I love my clients. I love my patients. But at the end of the day, I was going home drained and exhausted. And it was like, look, before I get angry and upset and hate medicine, it's time for a change.
Yeah.
And so I checked out what opportunities were out there, and I actually came on with Aratana.
Oh, no kidding.
And Aratana was great.
Yeah,
you know what made Aratana great is Aratana was small, and I came in as a professional services veterinarian, and I literally learned everything about pharma development.
Yeah.
Right.
So we got to talk to R&D, and we got to talk to marketing. In fact, marketing walked in and threw up 3 pictures. What do you think of these pictures as far as a marketing campaign? And I was like, well, that ball thing is distracting. And, and that's what they wanted. They wanted to know how a vet would react.
Veterinarian.
And it was interesting. And then I got to do the pharmacovigilance side and the regulatory side. And it was just amazing to see dabble in all of it and realize, because if anybody, and I tell anybody wants to transition into pharma, it's a great transition, especially when you've done clinical practice and you're just not getting that challenge anymore or that satisfaction. But what you have to realize is most big companies you go to, you're going to be here and you're going to do what you do. You're siloed. You don't get, marketing does not talk to R&D. Well, R&D won't talk to marketing because they don't want them to get the wrong impression and jump ahead of the thing. And I always laugh because I tell the marketing team, I'm like, yeah, you guys are one of those that you're creative. You push the envelope, and right when you're about ready to go over the cliff, I'm like, you can't do that. Yeah. You can't do that anymore. But I said, in big companies, you don't see the interaction. You don't, and everybody gets siloed.
So a small company.
So I was fortunate. Yeah, I was fortunate. In some big companies, not all. I did say, I won't say all or nothing, but in some companies, that's the way it is. And so as a newbie, I was so fortunate to see everything and realize what I liked more than others. And now I've got this CV that has stuff that I'm like, oh yeah, I did that.
Wow. So this is a
did that
great
too.
ending
I did that
of
too.
our first part of the podcast. We'll be back in 2 weeks.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.